Hi friends, this is Dr. Sujata Naik in our series, The Lesser Used Gems of Materia Medica. Today our remedy is Dulcamara. Dulcamara or the woody nightshade belongs to the Solanaceae family just like Belladonna, Stramonium, Hyoscyamus and Capsicum. It is proved by Dr. Samuel Hahnemann who called it a very powerful plant. The juice of this plant is extremely poisonous, contains the alkaloid solanin, which is a vagus nerve depressant. It slows down the respiration, causes a feeble rapid pulse, results in cardiac arrhythmia, pulmonary edema, and finally cardiopulmonary arrest. Its homeopathic proving, however, reveals a marked affinity to the skin, the mucous membrane, glands, and muscles. Therefore, very useful remedies for all kinds of chronic catarrhs, colds, for chronic bronchitis, asthma, in tonsillar and adenoid affections, in ear infections in children, in rheumatic diathesis, and in eczema. In children, crusta lactea or cradle cap is largely benefited by Dulcamara when the scalp has crusts with matting together of the hair. However, you must understand that Dulcamara cannot be prescribed without its characteristics, indications, and those are always there is an ailment from exposure to cold, damp atmosphere, cold, damp weather. Ailments from getting chilled in hot weather, sudden change of weather from warm to cold, getting wearing damp socks, having feet wet all the time. It comes very close to rust stocks in this regard. However, rust stocks is ailments from getting wet, whereas Dulcamara is ailments from being damp in people living in basement cellars where there's very little sunshine. So it is chiefly meant for those areas where there is the weather is very cold and there is a wetness in the atmosphere. So it would be ideally suited to the English autumn when there is a change of weather from warm and humid to warm and dry to cold and damp. So similarly, just as Natrum sulphuraticum, a very closely running remedy, where there is always ailments from damp, just like Dulcamara. However, in Natrum sulph, there is aggravation from warmth. There is no desire for warmth, unlike Dulcamara, which is so chilly that they crave for warmth all the time. The Dulcamara patient wants warmth, wants to be wrapped, yet is never better by warmth. Similarly, the Dulcamara patient, even in rheumatic conditions where there is so much of pain and stiffness in the limbs, yet the patient is aggravated at rest, cannot sit in one place because the pain gets worse when sitting. He wants to move. However, unlike rust stocks where there's just aggravation from first motion and amelioration from sustained motion, Dulcamara patient is not better by motion at all. They're always worse at night as well. A slight amelioration during the day. So compared to Natrum sulphuraticum, where Natrum sulph is also worse from rest, but Natrum sulph wants motion and is better by motion. So these are the strong differentiations between the closely running remedies. Natrum sulph would be more indicated for coastal climates like say Mumbai or in weather where it's warm and humid and damp. So in Singapore where there is rain most of the time and the weather becomes warm and humid, perhaps Natrum sulph would be more indicated as a remedy than Dulcamara. So whether it is an ear infection or whether it is any kind of problem, any kind of ailment, remember these characteristic remedies, these characteristic indications. We had a very interesting case of a 16-year-old girl who came to us for her problem of multi-drug resistant tuberculosis, not responding to any of the standard regimens of conventional medicines. She was put on several, the standard regimens she did not respond to, and her antibiotics were changed not less than 4 times and she did not respond at all. And when she approached us, she was frail and weak and dull and heavy, which is a characteristic of Dulcamara as well, because at mental level, Dulcamara causes a lot of fogginess, a lot of heaviness in the brain. Just as Natrum sulph is sad, sensitive and melancholic, the Dulcamara patient is heavy, chilly and extremely dull. So this girl was extremely dull when she approached us. And she was restless. She couldn't sit in one place. She was not getting relief from the shawl that she was carrying. And when we prescribed a Natrum muriaticum the first time based on all her indications. However, it did not help her. And on probing, we found that there was a history of exposure to damp weather, to dampness when she was living in a small room, in a small apartment just below another apartment where there was constant leakage from the bathroom faucet, and resulting in dampness of the walls of this girl's room. And there was no sunshine because the room did not face the sun. And persistently living in that room could have been one of the ailments from. And when we prescribed Dulcamara, the girl showed rapid amelioration, and she became more amenable to the anti-cox treatment that she was on. So this is a priceless gem, Dulcamara, when it is indicated. So no matter whatever the ailment the patient approaches you for, whether it's a chronic cold or a tonsillitis or an adenoid infection or psoriasis or eczema or pityriasis, a fungal infection, ailments from damp, cold weather or exposure or aggravation from damp, cold weather has to be there. Then your remedy is Dulcamara. Thank you.